Hi, everyone. It's Dr. Paul again from the East Ontario Health Unit, giving you a weekly COVID-19 update for today, May 4th, 2022. And as usual, I'm going to start to share my screen with you. This is a graph here that I just pulled out from the provincial data that gives us trends of cases and this is the East Ontario Health Unit trends. And this is the last month or so. And you can see our cases were up and down, up and down. They went up a bit, up to about 100 or so daily. These are daily cases. And then downwards, you could see here, and this probably was due to Easter break. And now it went up and down and kind of a sort of a downward trend. And this is just to give you a comparison over the last 90 days. So we're just getting out of the previous wave. We went down a bit and then started going up, peaked here, and then now is on the downward trend. So that's good. Again, we're seeing sort of that downward trend slowly but surely. In terms of our other numbers that we're following, you can see that right now we've got 8 hospitalizations, 4 in the ICU, and if we have not had a change in deaths, fortunately, since last time I spoke to you. And in terms of our numbers of hospitalizations, they're up. And then again, this is the number of patients that are admitted who are tested positive. Most are actually not in for COVID. They just happen to test positive. But if you look at our trends of hospitalizations due to COVID, particularly in our 4 hospitals, you can see that we are definitely on a downward trend here. ICU is stable, and I can tell you that provincially as well, we're under 2,000 admissions and hovering between 190 and 200 ICU admissions. So that's good because that's flattened and that's on the way down. So it hasn't reached the numbers that we were afraid we would, and it certainly hasn't reached the numbers that we had in the fall, actually in January. With the other wave. And this, again, is good news for us as well. This is the rolling average of our positivity. And you could see we were quite high, kind of April, and went up again. And then look, we're down to about 12%. The provincial one, I think, is about 13% as well. And this is another good news sort of trend. Again, we're down to 10 outbreaks in our long-term care and retirement homes. And again, it shows you a bit of a trend where we kind of peaked here back in April sometime, and then now going on a downward trend. And this is the number of residents. And again, contrary to previous outbreaks that we've had, particularly before vaccinations, the residents who are positive have been, most of them have been vaccinated and have very little symptoms, if any at all. And so for the most part, which is very good. And again, all of these now are attributed to the fact that we didn't go as high as we were worried we would with the 6th wave, and the fact that we are now seeing a blunting of the curve on the way down, I think is a tribute to the fact that many people got vaccinated, and the fact that we also had a lot of people got infected as well. So in January, February, and that gives protection to the community as well. This is the wastewater. And you can see that the orange is more of the trend. The blue is just sort of the individual numbers, but the orange is the one that we follow. And again, you could see this is back January, February, January. You could see it went down, up a bit, but now you can see it's leveling off. It's leveling off in all 3 of the areas that we're monitoring. And if we're looking at it provincially, we can see the same. You can see that, again, there was a bit of a peak here, and this is kind of probably Easter weekend related, and then now you can see we're sort of a downward trend, which is good news. And then if you look at it at the more local level, Eastern is definitely on the downward trend. And again, Eastern, I want to remind you, starts in Belleville all the way to our area here. You can also see that even the north now is going down. All areas are either plateauing or starting to go down, which is good news. So again, we're now on that other side of that curve where we want to go down as quickly as possible and keep it there, and keep it as low as possible. That's what we want to do. Again, this is just to give you an idea. Provincially, the same trends, and again, they're back down to about 13% here in terms of positivity. And again, you could see there was a peak around this time here, and then now it's on a downward trend. So that's good news for us as well. Looking at vaccinations, we're still at, again, the important thing is, again, now is, we're getting as many people to come in to get their 3rd dose and their 4th dose. We're at 88.5% of 5+. But if you were looking at our adults, we're over 90% both first and second dose. That's very excellent. Third dose overall, we're 56%. 57% overall, but it's higher among the elderly. And then fourth dose right now, we're up to 20% of our 60 plus population. And you could see that the older they get, and I'll show you the next curve, the older they get, that the higher the percentage of third and fourth dose. But we still have a ways to go, and I'll show you a bit later. But this is a new way that we're presenting it again, just to show you here. This is the COVID trends that we had in January going down. We had a bit of an uptick here, which is the positivity. The black dots here are cases. So you could see we had a bit of a bump upwards, nothing compared to what we had here. Don't forget, we started third dose vaccinating here. So I think that's what, and then a lot of people got infected. So that's why we did not get as big a peak as we did in January. And this is the ICU, and the same for the ICU and hospitalizations, which are in purple and in orange here. If we want to look at the specific data, we're again looking at the third dose, which is the green. And you could see that for the most part, 60 plus have got, quite good coverage, over 80% of third dose. But you could see that the younger age groups are barely at 50% overall. And certainly the 18 to 29s, the 30 to 39s are pretty low. So we'd like to get all these groups up to where they were in terms of the second dose, get it up to third dose, because that's going to give us more protection. And again, you could see that now 40% of our 80 plus, 23% of our 70 plus, 70, 79, and our 60, and only 9% of our 60 to 69s have got their fourth dose. So, and don't forget that the fourth dose is now open to people who have had their last dose at least 3 months previously, last third dose for fourth dose for 60 plus individuals. Again, just to show you that the third dose here, and I keep putting this up there, but just to show you that it does protect against hospitalization, as it gives you better protection and longer lasting protection. We also know that, again, individuals who have received the third dose, even if they do get COVID, it's less likely that we'll spread it to others. So again, the more that we vaccinate, the more we do all these things collectively, all these layers, the better we protect each other. Again, this just shows you, it's a similar curve that I had last week. It's all the same. The rates of hospitalization are by far higher, not only among the elderly, but among the non-vaccinated. And that goes, that's not changed at all. And so, now we've got the sixth wave, we're on the other side. How can we help lower it even more? Because what's going to happen is we're going to go into the summer over the next couple of weeks. We're going to go into the summer months, all respiratory viruses. And by the way, we are getting influenza as well, because of all the measures being lifted, a lot of other respiratory viruses are out there. So what we're seeing is, we're trying to now decrease that number, the base number of infections, as much as possible over the summer. And then look what happens in the fall, because again, in the fall, there will likely be an increase of cases, not only with COVID, but also with other respiratory viruses as well. So again, get vaccinated, get boosted, get your fourth dose, get your third dose. Again, we're looking at probably 40% of our population that still has not received the third dose. So we need to get that up to those levels, because again, it'll protect more against hospitalization and severe disease, and it will also protect others. So it's really good. And if you combine it with other public health measures, it's one of the best things we can do. And speaking of public health measures, wearing a mask, again, based on your individual risk situation, is highly recommended. I still recommend wearing it in indoor crowded places, at least for the next couple of weeks, and we'll reassess that. As I had said, I think May is going to be a turning point. We're entering May. I think summer is going to be a more normal summer. So let's cross our fingers. And again, let's work together to decrease that and blunt that curve as much as possible. Not forgetting, obviously, the public health measures, which are really hand washing, disinfection, and not going out when you're sick. I mean, those are the primary things that we're doing. Just a reminder that we have Paxlovid. We're prescribing it more and more in our area now. It's available in many pharmacies in our area. We're working with a lot of area physicians and hospitals to be able to send people who don't have a family doctor to get Paxlovid. This is a game changer in my mind. And so please, if you're in one of the categories, immunosuppressed, 70 years of age or over, 60 years of age with less than 3 doses, and somebody who's got any of the risks you're not fully vaccinated with diabetes, heart disease, those type of things, you are maybe eligible for a treatment within 5 days. And what happens is, we know that in very high percentage, 85, 90% of the time, if you start symptoms and we test you and you're positive and start this medication by mouth right away, you'll be able to we'll be able to prevent hospitalizations and severe disease at a very high rate. So again, this is not much new from last week. The only thing that I can tell you is that we are now seeing, I think we've turned that corner, we're going downwards. And like I said, as much as we can, if we can adhere for the next just couple of weeks, you know, just May just started, to still being careful, getting your third, getting your first or second dose if you haven't. You know, that in addition to the public health measures, still wearing a mask, I think, in indoor places. And again, that's going to be less of an issue. I think in a couple of weeks, we'll be able to reassess that. Will be more outdoors, more ventilated. So all signs point to a more normal summer. But again, we've got a couple more weeks, and there's much more there's more that we can do in terms of getting vaccinated and being aware, if you eat this, you know, if you fall into the category that you may benefit from getting oral the pills for COVID. If you have COVID, then please go ahead and get those pills, because those will prevent you from getting very sick. So thanks again, and see you next week.